This is a WACT Cape Fear Business Break.
Today we are in the studio talking with Dr. Lisa Rose Jones. She is with Novant Health Heart and Vascular Institute. Thanks for being here.
Thanks so much for having me.
Nearly half of Americans suffer some form of hypertension or high blood pressure. But what is pulmonary hypertension and what does that cause?
Yeah, thanks so much for asking. So pulmonary hypertension is definitely a distinct entity compared to systemic hypertension or high blood pressure that most individuals are aware of. So pulmonary hypertension means high blood pressure isolated to the lung vessel bed, and it can be for a myriad of reasons. Some of the most common reasons are related to other heart disease like heart failure or mitral or aortic valve disease, and it can also be related to chronic underlying lung disease, things like COPD, emphysema, interstitial lung disease. One of the things, though, that I'm looking for when I evaluate patients who are sent to me for pulmonary hypertension is understanding, do they have a distinct entity of actual thickening of the vessels of the lungs, something distinctly known as pulmonary arterial hypertension, and if so, targeting treatment.
What are the symptoms and how is it diagnosed?
So symptoms are most commonly shortness of breath or dyspnea, as we say in medical terminology, but it can also be other symptoms like swelling, lower extremity edema, pulling fluid in the abdominal area. Diagnosis is largely based off an echo that gives a suggestion of elevated pulmonary pressures, and a right heart cath is warranted. I encourage you to reach out and seek care at Novant Heart and Vascular Institute.
For more details, click the Health tab on WACT.com.